he will talk to us about the association between mental health conditions and vitiligo, a population-based cohort study in the UK. Dr. Thompson, the floor is yours. Go ahead.
Hello, I'm Andrew Thompson, and I'm going to be talking to you about the association between mental health conditions and vitiligo, and in particular a population-based cohort study that we've just conducted in the UK. I'm a professor of clinical psychology based in Cardiff in Wales in the UK, and I'd like to acknowledge my co-authors Victoria Alefadu and John Nesnas, and that this study was funded by Pfizer. We know that people living with skin conditions are at increased risk of experiencing psychological distress, and indeed a recent review looking at vitiligo found that people were more at risk of experiencing depression. However, this particular review was based on studies with a fairly small sample size and with participants drawn from specialist treatment centres or from hospitals, and this limits the generalisability of the findings, as of course most people with vitiligo are identified and treated in primary care setting. Therefore, there still remains a need to look at population-based estimates of the burden of psychological comorbidities associated with vitiligo. So the objectives of our ongoing study is to undertake a first large population-based analysis of the potential associations with vitiligo and mental health conditions. And today I'm just going to touch upon our initial findings in relation to prevalence and how this links to various demographic factors, namely gender, age and ethnicity. So the study is designed as a pre-registered retrospective cohort study, and we're using a large data set extracted from over 700 GP practices and over 10 million patient data records. And we looked at people receiving a diagnosis of vitiligo between January the 1st, 2004 and the end of December 2020. Vitiligo was identified by the presence of a specific vitiligo diagnostic code, and we excluded anybody that had another code for a depigmenting condition within 1 year of the diagnosis of vitiligo. And the prevalence of the three common mental health disorders was also based on the presence of recognised diagnostic code, and that needed also to be verified by evidence of having received treatment for that mental health condition in the form of either medication or psychological therapy. So we identified over 10,000 adults with newly diagnosed vitiligo during the 17-year data extraction window. The median age at vitiligo diagnosis was 41, and there were slightly more women than men represented in the data set. Ethnicity was well recorded, and 65% of people in the data set were recorded as being of white ethnicity, and actually Asian ethnicity was significantly overrepresented in the data with 20.5%, and we might have expected to see something more like 7.5% based on what we know about the population makeup of the UK. So at vitiligo diagnosis, this is the sort of headline findings, 5.6% had a pre-existing diagnosis of anxiety, 10.8% had a depressive episode, and 12.9% a diagnosis of recurrent depressive disorder. And all three conditions were more prevalent in women. We found that all three mental health conditions were more prevalent in sort of middle-aged people between the ages of 40 and 59. And we also found that depression was more prevalent in people with white ethnicity and was actually significantly different compared to people of black, Asian or mixed heritage ethnicities. And this is a sort of interesting finding. We might speculate that this could be due to a number of reasons, including under-identification of distress in those groups. So our future work is really to make comparison against matched control group drawn from the same database, and to look at the prevalence and cumulative incidence of mental health conditions in a 2-year period after diagnosis compared with the matched controls. So as we come to the end of the presentation, I would just say that understanding disease burden is crucial in order to plan services and make sure that people get the service that they deserve. And we conclude that there appears to be significant burden of anxiety and depression in adults with vitiligo, which varies considerably with age, gender and ethnicity. Thank you.
Thank you very much. Thank you very much, Dr. Thompson. Any questions in the Q&A? Let me have a look. Actually, no questions here, but thank you. Thank you for underscoring the importance of the psychological impact of the disease, because we have lots of people who have really psychological problems, and not only that they are a little bit anxious and depressed, but some of them even are thinking of committing suicide. And there was a question, no questions in the chat, in the Q&A, but yes, here, yes. Dr. Bashenbaum was asking, is it really a systemic disease? Evidence don't let me accept this. I would like to know your expert opinion.
In terms of the causes of anxiety and depression for people with vitiligo, I mean that's an interesting question. I mean, there is some evidence that the anxiety and depression is coming first for a significant minority of people, and that, you know, maybe talks to some common pathways around inflammation and so on, which might also be affecting mood. That said, we know that vitiligo is obviously burdensome for patients, can be highly visible. I mean, I think one of the things that surprised me in our findings was the difference in ethnicity, which was not what we really expected. And you know, I think across the board, services are generally lacking for patients in terms of additional support and identification. So yeah, I've gone beyond answering that question. So I think there is some suggestion that it might be part of the disease, but I also think we can't and shouldn't minimise the psychosocial impact as well.
Mm-hmm. There is a question from Dr. Iman Sani. Were the mental health issues diagnosed before or after vitiligo? And if before, was there a difference between before and after?
Okay, we're still looking at the fine detail in our analysis, and that's one of the purposes of this study, to look at where the mental health diagnosis occurred. Did it occur before the diagnosis, or did it occur after the diagnosis? And if so, you know, how does that pan out as the disease develops over the last, you know, over the next couple of years? And what we have found that for a significant minority of people, the depression, anxiety was there first.
Oh. Mm-hmm. Interesting.
You know, it's hard to, you know, it's obviously with this sort of study, it's hard to comment on causality. But you know, I go back to what I said before. I think it's likely that the psychological impacts are likely to be quite complicated for a number of people. There may be some common pathways in terms of inflammation and so on that are panning out and affecting the disease development itself, but also impacting on the development of mood disturbance. But equally, there's the psychosocial impact once the disease is visible.
Mm-hmm. Yeah, so it could be a comorbid condition from the very start.
Yeah, indeed.
Mm-hmm. Mm-hmm. Yeah, Dr. Samia Ismat is raising hands. So Dr. Samia, did you have a question?
Yes, I was just going to ask about the comorbid condition. Are vitiligo patients liable or susceptible to endogenous depression, and they have this issue, or it's only related to the environment, the environmental factor, when they have the lesions and when it appears?
I suspect both is true.
Yeah. Yes.
And there are some people where the psychological impact is predominantly a result of the disease burden.
Yeah.
And the impact of the disease. And I think there are that, but I also think there's probably some people where the psychological stress and the development of depression, anxiety has come first and may predispose them to then go on, if there's genetic vulnerability, to develop the vitiligo.
Yes. And does the duration of the disease, did you ever study the duration, how when they stay for a long time and they do not respond to treatment, does this increase the incidence or the type of the...
For this particular study, we're interested in that question of which came first and whether we can relate temporally the development of psychological distress to the onset of the vitiligo. So we've looked at quite a tight timeline in order to do that. So we can't answer your specific question with the data that we've got. But there are quite a few studies obviously out there in the literature already that do indicate that people with vitiligo are at slightly higher risk than people without a similar skin disease. And we know, for example, the British the BAD have just updated their guidelines for the treatment of vitiligo and are recommending psychological screening as part of routine care because of that increased risk.
All right.
Thank you very much.